Welcome back to our channel. Buckle up for a great learning adventure.
Occipital bone, the back door of the skull. The occipital bone is the bone you touch when you place your hand behind your head, right above your neck region. It's like the back door of your skull that not only protects the brain, but also acts as a passageway. The key structures safeguarded by this bone are the cerebellum and the brainstem, without which life wouldn't exist. The main structures that pass in and out of this doorway through the foramen magnum are the end of the medulla and beginning of the spinal cord. Now visualize the occipital condyles as brain nodding buttons. Much like a nod signifies attention, these buttons let the brain give a friendly nod, teaming up with the atlas or the first cervical vertebrae to create nodding motions that express agreement or interest. Think of the occipital bone's inner surface as a dynamic dance floor. Muscles, ligaments, and vessels perform a coordinated dance, attached and swaying in rhythm with head movements. This choreographed dance maintains the head's balance and agility. Lastly, the occipital lobe, the brain's visual wizard, resides within the occipital bone, resembling a master painter's studio. Here, the brain transforms the colorful light from our eyes into visual perceptions, crafting vibrant and detailed scenes like works of art. And now let's get into the details of this multitasking backstage manager. The occipital bone is a flat, roughly trapezoidal-shaped bone located at the lower back portion of the cranium, forming the back of the skull. It is one of the main bones that make up the human skull. One of the most prominent features of the occipital bone is the large opening, called the foramen magnum, which allows the spinal cord to connect to the brain and form the central nervous system.
Time for some fun facts. Did you know we have hundreds of such videos, mind maps, and notes? Go on, download our app and get access now.
The term foramen magnum means great hole in Latin, and through this opening, essential nerves, blood vessels, and connective tissues pass between the brain and the spinal cord. It is positioned at the junction between the occipital bone and the first cervical vertebra, or the atlas. The foramen magnum is divided into an anterior compartment and a posterior compartment by the presence of the alar ligament, a ribbon-like band that runs from the dens of the C2 vertebra to the occipital condyles. The primary function of the alar ligament is to limit excessive rotation and lateral flexion of the head and neck, and is therefore also known as the check ligament. Let's talk about the Opisthion and the Basion. In essence, the Basion and Opisthion are like strategic markers that guide the interactions between the brain and the spinal column, playing pivotal roles in maintaining stability, balance, and coordination throughout the body. Opisthion is the anchor point where the occipital bone meets the first cervical vertebra, or the atlas. It is the midpoint of the posterior border of the foramen magnum. Basion is like the fulcrum on a seesaw, a key reference point located at the front of the foramen magnum, the midpoint of its anterior border. It is where the base of the skull meets the cervical spine. It's like the central anchor that helps balance the skull on top of the spinal column. The presence of the foramen magnum divides the occipital bone into four main areas: the squamous part, the basilar part, and a pair of condylar parts.
Intrigued by this video? Want to learn more? The full video is waiting for you on our app and website. Head on over there now.